Well, thank you for staying with us, the entertainment and lifestyle. Not yet, just wait a bit, we'll get to that part. But we have a second conversation, and interestingly, we're looking at the World Cancer Survivors Month, Living Beyond Cancer, the reality of survivorship. And of course, we'll be talking to nobody else than Dr. Denise Ejoh, cancer survivor, founder, Cormode Cancer Foundation. Good morning, doctor. It's great to see you.
Good morning. It's great to see you too. How are you guys doing?
Well, very well, thank you. How does it feel being on the other side today? Because we're not handing over to you, you are a guest. All right.
I think I've got to do it now, so let's get on. Yeah.
Survivorship. And often in conversations, when we hear survival, we look at that person as someone who has lived through it and everything is now behind it, like the person is whole now. But could you walk us through it in the context of cancer particularly? What does it mean to be a survivor?
Okay. Thank you, viewers. Good morning and welcome again. Today, I'm sitting on the other side, like you said. So let's go from there. Survivorship. I'm going to explain survivorship, but in the same way, I'm going to use myself as examples all the way so that people get it. Okay, what is a survivor? A survivor is not limited to people who have just gone through a cancer journey. So, for instance, you have cancer, you get your treatment, you get cleared, because there are people that do get cleared, totally get cleared, and they don't have cancer anymore. There are people that get cleared but have to remain in continuous checking because of recurrence. And there are people who never get cleared and they survive. So all the three categories of people survive cancer in the sense that for every day that you live, you are a survivor in the cancer space or in the word cancer, because cancer is not, you learn very quickly that life is not promised with cancer. So if life is not promised, if you don't enjoy your few days, few minutes, few hours, few years, many years, like I'm enjoying 10 years, but yet I have a metastatic disease. I have a disease that it's not going to be cured. So, but I'm surviving. I'm not dying, at least in my own space. I believe God for that. I'm not dying yet. So that's surviving. And so when we say survivorship, we need to look at surviving through your storms, through your treatments, through your challenges, through everything that life has thrown at you, not necessarily meaning that I'm dying tomorrow. Surviving does not mean you are totally cured. It means you are going through a process, you are living that process, and you are going to get through it. It's your choice. So make an effort, please, and survive. If I can survive, you can survive.
All right. So yes, and I just heard you talk about metastatic breast cancer. You've lived with it for over 10 years. And talking about survivor, a lot of people may not understand the realities of living beyond the cancer diagnosis. Walk us through that. Let's really get an insight, because a lot of people may not understand it just by hearing it.
So let me explain what metastatic means. And metastatic is not just in breast cancer. Metastatic cancer is cancer that has moved from its primary. So whenever anybody has a cancer diagnosis, you have a primary disease, meaning they found the disease somewhere in your body. That is your primary. So that is where you were sick. So I'm talking as a layman. I'm not a medical doctor. I'm telling you as somebody that understands it. So especially for those who don't know what cancer is about, not the medical jargons, just ordinary layman English. You get a diagnosis and they say, you've got cancer. All right. And they tell you, oh, let's assume it's breast cancer or it's ovarian cancer or it's cancer. Okay, that is a primary diagnosis. When they now say it has moved from one place to the other, automatically it's metastatic. Metastatic, I have yet to be corrected, but as far as I know, you can never be promised to be cured from metastatic cancer, breast or whatever. because the treatment now changes from treating you for the first one, which is the primary, to also treating you from the secondary. And the secondary may not necessarily be one cancer. It may be more than one. So metastatic cancers, people can have breast cancer as a primary and end up with liver or kidney, whatever cancers, it can move. And that's one thing about metastatic. So metastatic means when a cancer has moved from its primary to its secondary.
All right. So
And
there's, okay.
So now go on.
So there's always this misconception that metastatic cancer comes after an earlier cancer diagnosis. But could you walk us through the process or explain to us what really happens? That's what happens to the de novo metastatic cancer, breast cancer, and how it helps us understand the processes that we need to go through.
Okay, now this is different. And let's go with this one. And this one is very rare. I have a de novo cancer, breast cancer. De novo cancers are cancers that there was never a primary. So, and I always say this thing all the time, and a lot of people always think I don't know what I'm talking about. When I was diagnosed with cancer, I was diagnosed with breast cancer. I have breast cancer. I am 10 years this August, but I've never had a breast lump. So when we talk about breast cancer, we need to be very careful about talking about cancer in the context of what it is. De novo cancers, the word de novo means new. I'm of the opinion that it has now been categorized to be new. So all those medical doctors out there, all over the world, and I'm now one of those with the rare disease, advocating and creating this awareness. There are a category of us who present with a secondary as knowing fully well there is a primary somewhere. And that primary needs to be found if the treatment that we're going to take is going to be correct. Having de novo cancer, your lifestyle is very different. So ordinarily, as a cancer patient, you have a lot of things you have to go through, all your treatment plans, your regimes. And to those who don't know what I mean by treatment plans and regimes is you would most probably have a surgery somewhere along the way. After surgery, you may have radiotherapy, which will automatically be a treatment option. May not be a standalone. You can have it or have it with chemotherapy. You will have chemotherapy. Some people get chemotherapy. Chemotherapy is not straightforward. There is no fixed rule about chemotherapy. I want that to be clear. Some people react to chemotherapy in different ways. I don't yet know of people who don't have a side effect to it, but the side effects are different. The way you live are different. The pains that you go through are different. But it is always for a short time because you can't take your next chemo until your doctor say you passed for your next one. So no doctor ever gives you chemotherapy without making sure that your bloods and your blood test results allow you to take chemotherapy. Then you have chemotherapy. Then you have what you call targeted therapy. Now, all these things that I'm telling you, I've had all of them. Some of them I still have, some of them I have passed and gone past them. You have what they call, I've had gamma knife. So gamma knife is where they use radio, but they target it into your head in specific. I had that about 10 years ago. Now they've upgraded and they now have something called SRS. And that is also a form of radiation. And it also targets the specifics. We then have something called immunotherapies. Most cancer patients who have had cancer end up taking immunotherapies. And immunotherapies are what we take to stop it moving. So is it exactly moving? Yeah, if you've, no, not moving, to stop what you already have from going up, if that makes sense. I don't know if it makes sense. Maybe you ask me a question that helps me to explain
Yes,
that
yes,
better.
makes.
Yeah.
I mean, we are all wrapped up in this expression and analysis. I mean, I almost didn't want you to stop because you're taking us through something real time and experiential. Because when you talk about chemo, I quite get it now that people don't just get up and get chemo after chemo. You have to be tested, and the doctor has to clear you for that after your
Yeah.
blood work, and that is very informative. Thank you so much for that. And now let's come to the Cancer Survivors Day, 2026. I know that some of the things that you have also brought to the fore is that the conversation on cancer care, cancer awareness, does not have to be on a day alone. It's a continuous engagement, and thank you for that. But what message of hope and encouragement are you bringing to cancer survivors and those who are even the caregivers this commemoration?
Okay. So am I going to say it as a message, or am I going to say it as advice? I don't know.
Both.
2026 to both. 2026, I am going to ask. First, I'm going to thank all carers. Let me go from that. Carers. And I'm going for carers first, not because the medics are not very important, but because the carers do not know what to expect. They don't know how to handle cancer patients. They don't know how to speak to us. And I'll give you instances. For instance, a lot of people come and sit down with us when we've got this disease and they say, sorry, sorry, sorry. A lot of the time, that's not a very, that is not helpful. What I would ask you, for those of you who are carers and don't know what to say, just sit down and let us talk to you. Trust me, we will tell you what is going on in our heads. But if you start telling us what you think we should be thinking, which is the problem we have, everybody tells us, don't eat this, don't jump here, don't go left, don't go right, don't do. But you're not sitting on the chair, so you really don't know. Not even a doctor can tell us exactly how to feel, because every single one of us feels very differently. So firstly, for carers, we want to say a very big thank you to you for loving us, for standing with us, for being with us. We know that you are crying in your rooms. We do know that. And I'm telling you thank you because we know. But we cannot take you on the journey with us because you can't carry what we're carrying. And if we take you on, we're going to go down. So for carers, that's the first thing. For the medics, we want to say, especially in Nigeria today, I cannot say anything differently. We are grateful. Grateful in the sense that we know that the medical teams, now that is not just the oncologists, but that is the surgeons, the nurses, all those people in that team, our psychotherapists, all the people that work in our space, because our space is not just the oncologists. We know you're understaffed. We know you're working too many hours. We know you're taking us home because of other reasons. And I'll talk about the other reasons. We're saying to you, we appreciate you. I know, or we know that a lot have left the country because of how do you say it? Because of what's going on, the challenges of life. But we're begging you, please, we need you. To the government, you are watching us. We're dying in drones. And that's not very nice because it's saying that our lives don't matter. If statistically, globally, the world says 1 in 2 people will die of cancer, will get cancer, that does not mean that 1 in 2 people will die of cancer. Now, if you calculate 1 in 2 people dying and getting cancer, let's say half Nigerian population, does that mean half Nigerian population are going to die of cancer? That's not what the world is saying. That's not what the data is saying. But then what is the government doing to make sure we survive? Because
Yes.
those centers are not working. The scan machines are not working. A lot of those things are not working. And if those things don't work, we can't access treatment. And we need to access treatment.
But Dr.
So these are
Dennis,
the three. Yes,
Yes,
ma'am.
yeah, just as you were speaking, you talked about government and you also talked about, patients. And what came to my mind is for those who have just been newly diagnosed or, currently in treatment, I mean, they sometimes there is confusion, there is helplessness, sometimes there is even resignation. What's your message of encouragement to them? Just hearing you speak to the government too.
Please, so that's to the patients. I'm going to say, please, firstly, when you get a diagnosis, don't run away from it. Please, I am begging you, go back. If you are not sure, go and get a second opinion. But do not say it is not my portion syndrome. By God, if I had said that, I will not be standing here today. Most cancer patients alive today made a conscious decision to find out, to go after it, and to address it. That's your only hope. So don't run under it's not my portion syndrome. Trust me, I trust God to the last. Anything I tell you, I say it all the time. If you go and check my post, God is too faithful to fail me. We all believe that. But in the same way, we must follow those treatment options. So what I'm saying to patients, you will not run away from the treatment. You will not run away from the doctors. You will stay there and take the treatments. A lot of the time, we're very good at asking for support, for help, for support on a lot of things. And I agree that cancer treatment is very expensive. The government needs to help us with the funding of this treatment. I mean, okay, some places are partial, but at least we're not getting. Even those who have money in their wallets cannot access the drugs. So I'm begging the government, give us the drugs. Let cancer patients access the drugs, because the drugs are our biggest challenge. Even if we have the money, we don't have the drugs. And that is our biggest challenge for 2026. Please, we have not been able to access Cancer Health Fund drugs since 2024. This is 2025. Now we're in 2026. I'm begging the government, on behalf of every single one of us, let us access drugs. We need the drugs to live. We need the drugs to survive. And we're not asking you for too much. Even if you are not paying the whole money, at least let there be the drugs for us to buy. Because we're not even seeing it to buy.
All right,
Government,
Doctor.
we're begging you.
Yeah, Dr. Ejoh, we hear you now, and if you had asked me before now, maybe lack of access to drugs would not have been a problem for me to mention. I would just go with, say, physical, financial, emotional challenges after that first diagnosis. But hearing you talk about lack of access to drugs, even with your own money, it's sort of a problem that we need to, as you say, come together and find a way around. But could you walk us through these challenges, financial, emotional, and the acceptance really for first timers or initial cases after that first diagnosis? How do you accept it and come to terms that in the meantime, this is my reality?
Mental health, yeah.
Okay. And it's very nice, because I like this question for one reason. One of the first things that happen to any cancer patient, so all of you that are, maybe you have heard it or you're already in the place, you are not different from any one of us that are here. We all die first. And when I say we die, is hope, everything is lost the minute you hear you have cancer. But you have to slap yourself on the back and say, I'm not going to die. I'm going to fight to live. And then starts the process. Now, once you have gotten past that first phase, and that is the phase where you cry, you look at everything, because I'll give you from my perspective. When I was diagnosed, I knew I was sick for a long time. So I was in Lagos, and the person gave me, they give us this disc. And in the disc, he tells us to take it to our doctor. And then he writes up, and that paper said I had 3 months. But that I should go and seek opinion abroad. And I did. So I'm telling those who are just coming in, I went to seek opinion somewhere else. Second opinion. Second opinion did all the testings. All this time, Your family, you have to remember, you have a family. For those who have children, you know now you have school fees, you don't know how you're going to pay it. You can't pay your bills. You have to pay rent. You have to pay food. You know, everything, your world crashes. But please, as it's crashing and you are crying, stand up. For those who have children, I know now, and I've known for the last few years, that a lot of patients give up the cancer treatment to put food on the table for their families. And that is the reality. So please, I'm even going to beg the public, when you know a cancer patient has cancer, don't kill us before we have died, because we haven't died. We are alive. Feed us now. Don't plan our funeral. People who tried to plan my funeral 10 years ago are still looking at me, and I'm alive. And I don't look it. I don't look the part. Most cancer patients do not look the part, except when we are really sick at the down. But once we are settled, we have a financial toxicity. And it's not about, and I go back to financial because it's not about the drugs. The drugs is one. Availability is one. But what of the cost of buying them? It's not available. But we can't even afford it. Then we finish that one. We've got our bills to pay. We've got, some of us have, someone like me now, I've had to use walking stick,
All right, Dr.
all
Ejoh.
those gadgets. So you're getting where I'm coming from. It's complex, but the government, we're begging you, please, we're a whole package. We deserve to live. This is 2026. I want to come next year and say, wow, this has happened, this has happened, this has happened, this has happened.
Absolutely.
And
Absolutely.
we'll be very...
Thank you so much. That was very, so lifted. And having you speak honestly and candidly, and that cry for help to the government to make drugs accessible, not just for yourself, for other cancer survivors, it's really keen. And I hope that the government does hear you on that. And we've been speaking about World Cancer Survivors Month, Living Beyond Cancer, the reality of survivorship, with Dr. Denise Ejoh, founder for the Cormode Cancer Foundation. Thank you so much for your outpouring this morning.
Thank you for having me. Thank you, everybody. And to the whole of Nigeria, please, it's Survivors Month. Celebrate with us. There are lots of activities going on across the country. Please just be part of it. Awareness initiatives, campaigns, different things going on. Just be part of it.
Indeed.
And see us happen.
Thank you. And we hear you. Anyone with cancer or otherwise is a whole package, just like persons with disabilities. All right, everyone, thank you for being a part of the program today. We're not leaving yet. We're having entertainment and lifestyle now.